Good evening, students. Myself Asma. I'm your Ops and Gynae faculty. So today we'll deal with a very important topic, that is fetal circulation. Fetal circulation आपके exams as well as MCQs point से काफी important है. So we'll deal this topic in next 10 minutes. So please pay attention. Fetal circulation is distinct from human circulation. How it is distinct from human circulation? As all of you know, placenta is the only source of nutrient and oxygenated blood provider to the fetus. And fetus lungs doesn't function before birth. So all the nutrient and oxygenated blood are provided to the fetus via a specialized shunt system. So fetal circulation को deal करने से पहले हम लोग सब human circulatory system को deal करेंगे. We'll quickly revise to that so that we can have a better understanding of fetal circulatory system. आप सबने पढ़ा होगा अपने स्कूल और कॉलेज के डेज में. सो बहुत ब्रीफ में रिवाइज करने वाले हैं. प्लीज पे अटेंशन. दिस इज सुपीरियर वेना कावा एंड दिस इज inferior vena cava. It brings all the deoxygenated blood from the body into the right atrium, and from this right atrium the blood passes through the tricuspid valve and moves into the right ventricle, and from this right ventricle, after ventricular systole, this blood goes into the pulmonary artery. And pay attention, pulmonary artery is the only exception which carries deoxygenated blood to the lungs. All the arteries carries oxygenated blood. Mark this. And from the lungs, pulmonary vein brings back the oxygenated blood. Pay attention. Pulmonary vein is the only vein which carries oxygenated blood in human body. So mark it. From pulmonary vein, the blood goes into the left atrium, and from left atrium through mitral or bicuspid valve, this blood pours into the left ventricle. So during ventricular systole, this blood goes into the aorta, and aorta is the major artery which provides blood to whole the body. I hope this diagram is clear to all of you. So we'll proceed to fetal circulatory system. There are three shunts in fetal circulatory system which we'll study. The first is C. This is ductus venosus. It is the shunt between umbilical vein and inferior vena cava. The second is foramen ovale. See, this is foramen ovale. It is the opening between right atrium and left atrium. The third is ductus arteriosus. This is the shunt between aorta and pulmonary artery. So, what fetal circulatory system consists of? It consists of three things. The first is placenta, the second is cord, and the third is fetal circulatory system. So, cord comprises of three things. One is umbilical vein and two are umbilical arteries. These are umbilical arteries, these blue one. So now we'll understand the fetal circulatory system. As you know, placenta provides all the nutrient and oxygenated blood to fetal circulatory system. So from placenta, oxygenated blood is passed through umbilical vein, which get divided into two branches. First branch, second branch. The large branch, which carries around 70 to 80% of the blood, goes into the liver, and the smaller branch, which carries only 20 to 30% of blood, joins the inferior vena cava through ductus venosus. So blood from liver, sorry, this was some technical issue with. So from this inferior vena cava and from this hepatic vein, blood directly pours into the right atrium. So here in right atrium, there is a foramen ovale. So most of the blood, around 70 to 80%, passes through this foramen oval into the left atrium, and the remaining blood goes to right ventricle through tricuspid wall. From right ventricle, during ventricular systole, this blood goes into pulmonary artery, but there is an shunt present in pulmonary artery between aorta and pulmonary artery. This is known as ductus arteriosus. When blood comes here, most of the blood, around 70 to 80%, goes into the aorta, and remaining 20% goes to the fetal lung. So fetal lungs are not functioning, so they can survive on 20% of the blood. So the aorta, the descending aorta, this one further bifurcates into left and right hepatic arteries, and it gets divided into internal iliac arteries. These two internal iliac arteries further joins with two umbilical arteries, and these arteries goes to placenta. These arteries are carrying deoxygenated blood. Let's come back. So, in the left atrium, blood is present, which had come from right atrium through foramen oval. So, in left atrium, the blood passes through bicuspid valve into the left ventricle, and during ventricular systole, this blood goes into the aorta, and the same mechanism follows as aorta brings the blood down through descending aorta and then to hepatic arteries, which joins the internal iliac arteries, and then to umbilical arteries, which joins the placenta. So this is the fetal circulatory system. I hope this mechanism would be clear to you. See, when fetus is born, so there is closure of ductus venosus, ductus arteriosus, and foramen oval. So we'll see what changes occur in fetal circulation post-birth. So first of all, ductus arteriosus remanent would be ligamentum arteriosum. This is important from your MCQ's perspective. And foramen oval remanent would be foci ovalis, and the ductus venosus remanent would be ligamentum venosum. You can record or take picture of this slide. So functional closure and anatomical closure of ductus arteriosus would occur 10 to 96 hours post-birth. It would be functional closure, and anatomical closure would be within 2 to 3 weeks. Then foramen oval's functional closure would be within several minutes post-birth, and anatomical closure would be 1 year after birth. And the third, ductus venosus, would be closed within several minutes post-birth, and anatomical closure would be 3 to 7 days post-birth. This table is important. It could be asked in any MCQs. So there are two one umbilical artery and two umbilical veins. So umbilical arteries would get converted into umbilical ligament, and umbilical vein would get converted into ligamentum teres. Hope this topic is clear to you. Thanks for watching. Thank you.